I'd like to introduce Professor Nicholas Procter from the University of South Australia. Professor Procter is Chair, Mental Health Nursing and leader of the Mental Health and Suicide Prevention Research Group at the University of South Australia. Working with communities of practice, the research group brings together people with lived experience, carers, clinicians, policymakers, and academic faculty. Professor Procter has been a chief investigator on nearly $9 million of grant funding since 2014. To speak on barriers to help-seeking police in SA, the research report, Professor Nicholas Procter.
Good morning, and thank you very much for the opportunity to present. I'm actually presenting this piece of work on behalf of Dr. Amy Baker. Amy Baker, the leader and essentially the person who conceptualised this work. She's unable to be with us today, so I just want to give full credit to this presentation being Amy's presentation. So what I'm going to present on is some work that's been funded by the Road Home, and we're very grateful for that funding, which examines the barriers and enablers for help-seeking among first responders, and primarily for today's presentation, it's police officers. And at the core of this piece of work is trying to understand what those barriers are from the perspective of those people who live and work in those occupations, but also what are the solutions, what are the enablers, what are the resources, and what should be embedded in those resources to be able to provide support for people. So this presentation concentrates, if you like, around the outcomes of the second aim. Data that I'm going to draw from is based on 15 one-to-one interviews with first responders, plus a very sophisticated and fruitfully engaged online platform for people to come and discuss, if you like, as a focus group. And they created their own identity, their own name to be part of that focus group, to talk us through those issues and what the solutions might be. And one of the, I guess, important things to say very early in my presentation is this is a piece of research, a body of work with people, not on people or to people. So there's a fundamental core belief of information exchange, capacity building, shared learning to discover new ways of thinking and acting. So collectively, participatory action research is collaborative, practical, applied, and it's been chosen, and I think very successfully, for Amy's project. That might be a little bit hard to read for some people, but fundamentally it talks about the participatory action research, the PAR stages, and tries to, if you like, unpack those steps which are discrete and independent but interrelated with each other at the same time. And you'll see that the discovery of the barriers and then the progression to solutions or enablers is developed and defined progressively and situationally as the data is collected and understood and the discussion unfolds. So in the early phases of the reconnaissance phase, this is really about hearing firsthand what people themselves, how they want to be approached, what the engagement strategy will be. So many of my slides in this presentation, Amy's presentation, will have some text embedded on the right-hand side to sort of give you a stronger sense of what that looks like. So it's a voice of a first responder that you'll see on the italics on the right-hand side, where for that particular person, HW1, they're telling the story of how important it is for them, for first responders, to learn to recognise the warning signs for themselves. So, if you like, problem identification. This will be a little hard to read. This is a screenshot of that discussion of the online focus group, and we will be publishing, certainly will be publishing this material, but here we have the descriptions in much fuller detail of why it's important and the full and frank descriptions of where it hasn't gone well in the past. In the planning phase, it's around planning the strategy. So the focus is really around personal strategies related to building resilience and self-awareness, and these have been developed and defined by first responders themselves. And these are some examples of what participants shared in the planning phase. And you'll see there in the italics, a recurring theme is the lack of trust that members will get when it comes to the support they need from the organisations they work for. So trust is a fundamental requirement for addressing barriers but enabling success in terms of mental health concerns for first responders. And similarly, in the action and observation phase, this is about developing a strategy, developing an accompanying resource. And during this stage, if you like, the focus is on building resilience, self-awareness and action for first responders. So here's a quote from somebody who took part in that phase. Building resilience is the way to go by giving people the ability to recognise that they aren't travelling well, so these are the words of participants, and for them to have the tools and ability to do something about it that's right for them, that's tailored for them, so that individualised, person-centred or personalised approaches, in my language, personalised and person-centred approaches are starting to emerge. And similarly, in the evaluation phase of this project, this is an opportunity for these first responders to provide final feedback and commentary about created documents. So what we're really talking about here is the ability to be treated respectfully, to be treated well, to be pitched at the right level, and it puts together the points in a logical order. So resources that flow. Well, the online focus groups were really quite compelling at times, and you'll see here the voices of first responders talking about individual recognising the need to address their stress and concerns where knowledge is power. Identifying bad stress and knowing when to take a break. So in a sense, being able to self-regulate and calibrate what's right for me. But at the same time, having your manager on board and being able to support you as well as your colleagues is essential. So the focus, if you like, around this particular project has been certainly the development of a resource. There are certainly issues and significant barriers with regard to how first responders can contribute. They don't want to wade through a range of administrative blocks and, well, roadblocks or redirections, if you like. Personalised care, person-centred, the choice of counselling support, honest, truth-telling exchanges at the time of need, confidentiality and privacy. And what I really like about Amy's project and what I think she's captured so well is that she's asked for this advice from the participants themselves, people who live and work in that world. And it's really the tribute back to those first responder participants that enable her to develop this strategy. So she has drafted a strategy and a resource which will be made available shortly. And I'm certain that it will be distributed widely. And again, I want to acknowledge on behalf of the team and Amy in particular that this research would not have been happening without the support of the Road Home, who have been incredibly supportive and encouraging of the research. So thank you very much, everyone.